Welcome to The Explainer. Today, we're going to do something a bit different. We are treating our journey through the human body not just as your standard anatomy lesson, but as a tour through an absolutely intricate three-dimensional architectural marvel. Because, when you really think about it, the human pelvis and perineum have to perfectly integrate our reproductive, our excretory, and our structural systems into this incredibly compact space. And they do all of this while supporting literally the entire weight of our upper body. It is a total masterclass in structural engineering, and we're going to dive in and explore exactly how it's built. Okay, let's look at the itinerary for our tour today. We've got 1. The bony framework. 2. Mapping the perineum. 3. Genitalia and urinary viscera. And finally, 4. Nerves, blood, and lymphatics. All right, starting with section 1, the bony framework. Because just like any great skyscraper, you really can't understand the rooms inside until you understand the heavy, basin-shaped foundation that's supporting absolutely everything above it. So this sturdy framework is formed by the 2 hip bones on the sides, and they lock in right with the sacrum and the tailbone, the coccyx, in the back. But the thing you have to remember is this isn't just some static, rigid bowl. It's a highly dynamic, weight-bearing ring. Its whole job is to take the entire load of your upper body and transfer it right down into your lower limbs. It is quite literally the cradle of our internal architecture. Structurally speaking, we actually divide this bony basin into 2 distinct zones. So picture a line just sweeping around the inner edge of this bowl. We call that rim the pelvic brim, or the iliopectineal line. Now, everything flared out above that brim is the pelvis major, or the false pelvis, which mostly just helps support our lower abdominal organs. But right below that brim, dipping down into that deeper cavity, is the pelvis minor, the true pelvis. And this is the heavily guarded VIP vault where our most delicate pelvic organs actually live. And what's absolutely fascinating here is how this skeletal blueprint adapts based on biological needs. For instance, the female pelvis is structurally adapted specifically for childbirth. So it's noticeably wider, it's shallower, it's lighter, and it has this transversely oval inlet and a much wider subpubic angle. By contrast, the male pelvis is generally heavier, it's thicker, deeper, and has more of a heart-shaped inlet. It's the exact same fundamental bony components, just modified beautifully to serve 2 very different primary functions. Moving right along to section 2, mapping the perineum. So going from the foundation to the floor plan, we are leaving the bony cavity itself and entering the region right below it. Now, you might be wondering, what exactly seals the bottom of this thing? We've got this heavy, bony ring, right? And there's a massive aperture at the very bottom. Gravity is constantly pushing down. So what keeps our visceral organs from just falling straight through? Well, the answer is this highly specialized hammock of muscles and fascia, and it's bordered by very specific bony landmarks. If you trace the bottom opening, you hit the pubic symphysis in the front, the 2 bony prominences that you literally sit on, your ischial tuberosities on the sides, and the tip of the coccyx in the back. Connect those 4 dots, and bam, you've got a clear diamond-shaped region closing off the very bottom. That entire diamond, that's the perineum. To make sense of this incredibly dense real estate, anatomical architects draw a horizontal line straight across that diamond, right between those 2 ischial tuberosities. Just by drawing that one line, we split our floor plan into 2 highly specialized triangular rooms. The front half becomes the urogenital triangle, so reproductive and urinary exits, and the back half becomes the anal triangle, dedicated to the digestive exit. To show you just how tightly sealed these specific rooms are, let's look at a pretty crazy clinical scenario. Say there's trauma and a specific part of the urethra ruptures. Where does all that leaking or extravasated urine actually go? Well, because of how the fascial layers like Colles fascia and the perineal membrane are so firmly attached to the bone, they act kind of like watertight bulkheads on a ship. A ruptured bulbous urethra will force urine to spread up into the lower abdomen or down into the scrotum. But it perfectly blocks the fluid from leaking into the thighs or backward into the anal triangle. The fascial walls hold absolutely strong. It's an amazing design. All right, section 3, genitalia and urinary viscera. Let's see what specific fixtures are actually installed inside these carefully mapped urogenital and anal rooms. This is one of the most mind-blowing aspects of human development, honestly. Despite looking vastly different in mature adults, the male and female external genitalia share profound structural homologies. I mean, they stem from the exact same embryonic tissues. The labia majora in females, that is the direct structural homologue to the scrotum in males. The highly sensitive erectile tissues of the clitoris, directly homologous to the penis. It's the exact same architectural raw material, just folded and developed using different genetic blueprints. Taking a quick look at the male setup specifically, the scrotum is a really unique cutaneous pouch. Notice what's missing. There is absolutely zero insulating fat here, none. And that's a literal design requirement to maintain a cooler temperature than the rest of the body, which is absolutely crucial for healthy sperm production. But its protective double-layered sac, the tunica vaginalis, can sometimes accumulate fluid if there's an infection or an injury. And when fluid gets trapped in there, it creates a clinical condition we call a hydrocele. Okay, let's pop back up into the true pelvis for a second, because there's a classic, literal lifesaver of a surgical mnemonic I want to share. Water runs under the bridge. The water here is the ureter, the delicate tube carrying urine from the kidney to the bladder. The bridge is the uterine artery crossing right over top of it. Because they run so incredibly close to each other at the base of the broad ligament, the ureter is super vulnerable to accidental clamping during procedures like a hysterectomy. Remembering that water runs under the bridge has literally saved countless patients from really severe surgical complications over the years. Following those ureters all the way down, they eventually empty into the urinary bladder, which is tucked snug right behind the pubic bone. Now, the bladder has an apex, a fundus, and a neck leading out, but inside it's equipped with this highly specialized, perfectly smooth triangular zone called the trigone. The way the ureters pierce obliquely into this trigone is pure genius, because as the bladder fills up and expands, it naturally squeezes those ureter openings shut. It acts exactly like a mechanical one-way valve to stop urine from dangerously sloshing backward up into your kidneys. And finally, Section 4, nerves, blood, and lymphatics. Because you can't have an architectural tour without checking the wiring and the plumbing that keeps the whole system communicating and draining, right? Let's trace the main electrical cable of the perineum, the pudendal nerve. This thing takes a remarkably quirky route. It starts inside the pelvis, exits out the back through the greater sciatic foramen, hooks a really tight U-turn right around a bone called the ischial spine, and immediately ducks back inside through the lesser sciatic foramen to get to the perineum. From there, it travels safely inside a fascial tunnel, the pudendal canal, where it splits off to provide all those critical motor and sensory signals to our urogenital and anal triangles. So why do we care about this crazy looping pathway? Because knowing it is clinically vital. By mapping exactly where this nerve hooks around that ischial spine, physicians can do what's called a pudendal nerve block. They inject a local anesthetic right near that specific bony landmark, which effectively cuts off all pain signals from the entire perineal floor. It's an absolute game changer of a targeted technique, especially during childbirth or minor perineal surgeries. Now for the internal plumbing, the quiet, invisible network of our lymphatic vessels. The systematic way this fluid drains is so cool. Lymph from the superficial perineal areas, like the scrotum or the labia, actually doesn't drain straight inwards. It travels up first, all the way to the superficial inguinal nodes right at the crease of your groin, before it cascades deeper into the iliac nodes alongside the major blood vessels. Tracking this counterintuitive pathway is totally critical for doctors to understand how infections or cancers might spread from the surface deep into the pelvic cavity. So, as we wrap up this explainer, I just want to leave you with this final thought. Think about what we just looked at. We have a heavy, load-bearing skeletal basin. We have watertight fascial compartments stopping internal fluid leaks. We have delicate reproductive organs sharing exact embryonic origins, and we've got looping nerves and brilliant one-way plumbing, all packed into a space you could pretty much cover with your two hands. How did evolutionary engineering pack such absolutely vital, disparate systems into such a flawlessly integrated space? The sheer, compact brilliance of our own internal architecture is just breathtaking, right? I really hope this gave you a whole new appreciation for the floor plan of the human body. Thanks so much for joining me on this tour.